September 1st, 1939, Germany blazed Poland, kicking off World War II. On the same day, Hitler signed a document that empowered psychiatrists to execute patients for genetic reasons. This yellow paper killed 200,000 people. Before that, a eugenic movement was in full swing in the United States. It preached to give a good birth and good care. When the movement spread to Nazi Germany, the idea coincided with fascist ultra-nationalism and was strongly pursued. The 1930s witnessed the sterilization of some 300,000 Germans with diagnoses of mental illness. And the document signed by Hitler deprived 200,000 people of their lives in just 2 years, ranging from mental patients to those with only mild symptoms of mental abnormality. Although this was later considered a fascist purge of dissent, it shocked the world. A year later, Professor S.R. Hathaway and Professor J.C. McKinley, MD from University of Minnesota, published the most rigorous diagnostic scale for mental illness in the history of psychiatry and psychology. That's a Minnesota Modified Personality Inventory, MMPI for short. One of our members had experienced psychological care due to academic stress and found out MMPI is used to examine mental illness in both psychiatric departments and counseling rooms. Here I talk about MMPI and will share her experience at the end of the video. It's not a psychological test that can be found everywhere for entertainment, but a professional skill for clinical diagnosis with 566 questions, which can distinguish not only normal people from patients, but also make a simple assessment of the personality of ordinary people. The questionnaires will accurately detect a person's personality and whether they have mental illness. Yes. It contains more than simple questions like, did you have lunch? It even detects lie and pretend. For mental illness is diagnosed before introduction of MMPI. This is a well-known Rorschach ink blot method. The doctor gave you several meaningless pictures and analyzed your psychological condition based on your reaction and description. Although the Rorschach ink blot method is a rigorous system, it relies on the professionalism and clinical experience of the doctor. Therefore, it has high requirements for doctors. By contrast, the MMPI quantifies all questions. Its results are closely calculated and physicians use them as a reference for diagnosis. How does MMPI do it? We give each abnormality a specific color. These are part of questions and they correspond to symptoms in this way. Red questions are related to schizophrenia and dark blues are related to depression. The colors were scattered so that they couldn't fill the intent of questions. For example, question number 23 connects the somatic symptoms of depression. If the answer is yes, column D will get 1 point. Question number 27 connects the symptoms of delusional disorder. Yes, I'll give column pen 1 point. Question number 32 is related to social introversion, psychasthenia, depression, hysteria, and psychopathic deviation. And a yes here will give each of their columns 1 point. The MMPI makes all colors according to the proportion of the answers and finally synthesize personality. When you complete them all, the system will give you the original points corresponding to each disease, then convert them to standard score and present with a broken line graph visually. The MMPI contains 504 disease screening questions and 62 lie detection questions, the uncolored ones, which are its essence. In fact, before the MMPI, Woodward R.S., a famous psychologist, developed the first personality test during World War I, the Woodward Personal Data Sheet. But its Achilles heel was too straightforward to be guessed what its other questions pointed to. It allowed people to lie on the test. The MMPI has 4 specialized mechanisms for lie detection and shooting called validity scales, including lie, question, correction, and validity. Let's start from lie. Questions number 15, 30, 45, 135, and 285 are separate lie. They list many bad things that we're ashamed to admit, like bad-mouthing, swearing, and taking advantage of others. Some people have these problems, but they don't want to admit it. Those who overly conceal their mental state lie not only on these questions but also on other topics, so that their test results are inaccurate. The MMPI can get the score of lie based on these questions. Similar to lie, corrections questions are designed to test whether testees try to disguise themselves, also called degree of self-defense. Its questions cover uncommon topics, some of which are beyond people's thinking. These questions often have no definitive answers. Question numbers 71, 89, and 124 are typical. Scores here increase with degree of uniformity of the answers. If you give no to all questions, the answers are highly uniform, and this indicates that you are not open enough to test. The above cases are trying to hide their condition. However, there are people trying to linger, so validity is also very necessary. It involves a number of psychiatric symptoms that are familiar to general public. For example, question number 151 refers to persecutory delusion, number 156 to amnesiac, and number 184 to auditory hallucination, a typical manifestation of schizophrenia. Validity is very clever design. Few patients suffer from multiple mental illnesses at the same time, and few members of the general public know this. From this logical point of view, if a patient showed almost all symptoms, he was most likely linger. Many cases confirm that criminals who try to escape justice by being mentally ill score high on this scale. The exception is depressed people who tend to score high on validity because they're desperate for help and unconsciously exaggerate their symptoms of their survival instincts. So it's better to look at it case by case. The remaining 16 questions are repeating and they serve the question. For example, question number 8 and 318, number 13 and 290, and number 16 and 315 are the same, and they're designed to examine whether testees concentrate on answering questions. They're so far away from each other that it's hard to be noticed that they're the same. The same questions have different answers means that testees hasn't been concentrated or suffers disturbance of thought. Those are like killers. If 1 or 2 of them score about 60, test results are not credible. Warnings may be included in analysis to remind physicians to be cautious about the reference value. In its follow-up application, however, we found that patients with higher scores on lie and validity usually have problems distinguishing between good and evil and cognitive impairment due to mental illness. Perfectionists and highly self-focused individuals score high on these 2 scales too. In fact, everyone is more or less disguised, and it's very one-sided to make a judgment based on the result of validity scales merely. Therefore, to avoid being misled by the results, we strongly stress to take the test under guidance of a physician. Today, MMPI is to assess the personality of a person or a group and to make predictions about subsequent behavior of the group. In a 19-year study, more than 600 compulsory drug rehabilitators participated in the MMPI test. The results showed that addicts scored significantly higher than common people at hypochondriasis, hysteria, and paranoia. That's in line with their clinical manifestation and confirms the hypothesis that addict personality has an impact on drug use behavior. A more detailed study found that personalities of drug users differs. For example, heroin users are more concerned about their physical feelings and illnesses than meth users, so their somatic symptoms are more severe, and they're more impulsive and less disciplined. And personality disorders increase with years of drug use. Although the MMPI is professional and rigorous, it's not perfect. Its diagnostic criteria are not fixed, which makes it limited by characteristics of people tested. When the MMPI was first introduced to China in 1980s, Chinese psychologists found that its diagnostic criteria couldn't be applied to Chinese people because it was based entirely on American criteria. Chinese people are more implicative and encyclopedic than Americans. It's difficult to detect psychiatric patients who grew up in a Chinese environment according to American criteria. Chinese score high in depression and schizophrenia and lower in others. It's stressed that the Chinese are more emotionally stable but less confident and more easily to get nervous. Others gave similar results. In 1984, the Institute of Psychology (CAS), led by Professor Song Weizhen, started localization of MMPI in China. After 2 years trial, 3 years standardization, and 2 years clinical validation, the Chinese MMPI was finalized. Today, China's MMPI is still updating on a decadal basis to keep up with people and ensure accuracy. Perhaps you're wondering what my colleagues suffered from back then. In late 2018, I had depression due to academic stress. I was treated for depression until I had my first MMPI in 2019, when I was first diagnosed with bipolar affective disorder with both depression and mania. I was very cooperative with doctors by early 2020. I had an MMPI again, and the result was mild mania and depression index was normalized. Recently, when we made this video, I opened MMPI test page to experience its torture again. The analysis report showed that I was normal, as expected. I was so relieved. However, I'm now so focused on my physical and mental state and I scored high on validity. From illness to recovery, MMPI has digitally documented my journey. If there's more I'd like to share, it'd be a suggestion that everyone who is experiencing mental problems should seek medical help actively. Psychological problems are nothing more than emotional code, and doctors are perfectly capable of dealing with it. Thank you for watching. Please hit the like and subscribe button if you enjoy it.